Welcome to Up Level, Real Health, Real Talk with Dr. Jenna Blasi. I'm Dr. Jenna. I spent years crafting ways to help women thrive, and I want to help you do the same. On this podcast, we dive deep into health at every level, focusing on the mind, the body, and the spirit. This is where real conversations meet transformational wellness. We'll be talking about all the things that truly matter, from nutrition and fitness to lifestyle, mindset, and personal development. Plus, the real deal on managing stress and navigating menopause. So if you're ready to elevate your health journey with authentic, transformative insights, you're in the right place. Let's get started. And welcome to Up Level, Real Health, Real Talk with Dr. Jenna Blasi. I am Dr. Jenna, and I'm looking forward to being here with you today. And we are going to get into perimenopause and menopause. This is a big topic, and it's such an important one because there's so much that we can do in this time of life to prepare ourselves and to address this transition. There are many ways that I could tackle this subject. So what I'd like to do today, and we'll probably do a several part series, if not even more, to go deeper into things. But at the very least, I want to do an overview today to understand perimenopause, menopause, and what these mean, what we can do during this time, and what common sort of myths and misconceptions are. And so perimenopause is the transitional phase leading up to menopause. It is characterized by hormonal fluctuations that can start years before menopause. Menopause is 1 year without your cycle. So it's really a day. Once you've reached 1 year without your cycle, you are menopausal, and then there's early menopause and late menopause. So perimenopause is the period of time leading up to that. And I want to highlight the significance of understanding these transitions for proactive health management. There is so much we can do in this time frame, and many doctors, don't know what to do. I think the stats are something like 95% of graduating medical residents and fellows do not feel confident treating menopausal or perimenopausal women, and over 50% of them didn't even know what the main treatment options were. And there's one of the misconceptions is, you can't take hormones till you're menopausal, for example. And so we're going to break down some of this, but understand that perimenopause often begins in a woman's 40s. It can start earlier, but if it's earlier than 40, we're looking at more of premature ovarian insufficiency. And so we want to rule out other causes and kind of find out what is maybe going on. But common symptoms: irregular periods, hot flashes, night sweats, mood swings, sleep disturbances, vaginal dryness, decreased libido. There are many symptoms that are accompanying with perimenopause and menopause. Now, some women don't experience any or few. I don't know too many women that don't experience any, but some women say, oh, I went through it like a breeze. But there's all different levels. And as I mentioned in last week's podcast, our attitude does matter. The way we view menopause does matter. This doesn't mean that these symptoms aren't real. Our hormones are changing. The symptoms are real, but our mindset and our attitude towards menopause absolutely affects the symptoms and the symptom severity, just like everything else. When we're stressed, we might get an upset stomach. And so recognizing these symptoms, consulting healthcare providers that you trust for management strategies, with the recognition that in the conventional system, most of them are not trained to know how to help you. So find a menopause specialist. So as I said, menopause is 12 consecutive months without a menstrual period. And the hormonal changes are declining estrogen and progesterone, and these have huge effects on the body. And in perimenopause, these hormones are still changing. Progesterone is declining, estrogen is going up and down, which is why if you go into your practitioner and maybe you have your estrogen checked and they tell you you're completely fine or you're completely normal, they may also check your FSH and tell you that's fine. And both of those things are very variable. One day your estrogen's high and then it's low, and then it's high and then it's low, which is also why we feel kind of crazy. One day we feel normal, the next day we feel like we're in a rage. I remember when I was going through perimenopause and I hadn't really realized it yet. And I felt really erratic with my mood with my 5-year-old daughter. And I thought, oh my gosh, of course I'm perimenopausal because I didn't have the patience that I wanted to have with her. And so there's things that we can do to help ourselves feel better. So we really should look at what is the symptom picture? How is it affecting your quality of life? Continued hot flashes. So if you're postmenopausal, this still applies to you because you might have continued hot flashes. You might have bone density issues. The greatest amount of bone loss occurs, like I said, before that last menstrual period and in the few years following. And so that's where actually a really crucial time that hormone therapy might be really appropriate. There's increased risk of cardiovascular issues. Women start having insulin resistance, high blood pressure, changes in body composition, such as increased abdominal fat. And so it is important to have regular health screenings and do preventative measures during this stage. That is a separate topic that we could go into if you all want in terms of screening and labs to look at and how I feel about mammograms, which is probably different from most of the people in my profession. But let's look at treatment options and lifestyle changes. Many of the things we've talked about in this podcast will absolutely help your menopausal symptoms. I can't stress enough the importance of lifestyle modifications for everything that we could talk about on this podcast, health-wise. Diet, adopting a balanced diet that's high in calcium and vitamin D to support your bone health, to keep inflammation low, regular physical activity to maintain cardiovascular health, manage your weight, manage your insulin resistance, help keep the weight off so that your blood pressure stays down, stress management. Talked about that last time. Techniques such as mindfulness, yoga, meditation to alleviate mood swings, improve your overall well-being. Those are the foundations of health, and they apply here. They absolutely apply here. But there are other conventional and naturopathic approaches. There is hormone therapy, still called HRT, hormone replacement therapy, but now called hormone therapy or MHT, menopausal hormone therapy. Always an individual choice. And if you work with a skilled practitioner, you can make an educated decision together because most people are good candidates for hormone therapy. There's benefits, there's risk, and it's always a risk benefit ratio that we're looking at. So I'm going to get into that a little bit later in this episode, but may do a whole separate episode on hormone therapy if that's of interest. And I think it's an important topic that we all understand. There's also non-hormonal medications, options for symptom relief, such as SSRIs and other medications. I'm not going to go into those. I like to start with the pillars of health. Personally, I like to start with the pillars of health. I like to start with some of the natural alternatives and/or hormone therapy before these non-hormonal medications. Doesn't mean they might not be the right fit for you. And natural alternatives, we're going to get into that a little bit. There's not great evidence around them. It varies, but herbal supplements, acupuncture, other complementary therapies. So again, I encourage you, find the right mentors, find the right healthcare professionals to really develop a plan that's personal for you. Looking at some of the common myths and misconceptions. One myth, menopause occurs suddenly. The truth is menopause is gradual. The transition, known as perimenopause, can begin, as I said, years before your menstruation stops, with symptoms developing over time. And I hear so many doctors say, oh, you're too young for menopause, or oh, it's not menopause, or oh, it's just stress, or it's just because you're tired. It's like, which came first, the chicken or the egg? Just because you're not sleeping well, yes, that can affect your menopause symptoms, but it could be because of menopause. And so really understanding the symptoms and addressing you as a whole person is so important. There's another myth that menopause only causes hot flashes. And the truth is, hot flashes are the most common, and hormone therapy is one of the best ways, truly, to address hot flashes. Menopause can lead to many other things, as we talked about: mood changes, sleep disturbance, libido changes, body composition changes, vaginal dryness changes. So what comes with this is another myth that menopause marks the end of a woman's sex life. I'm done. My libido's gone. I'm dry. It hurts. I'm done. I don't feel good about my body. I mean, so many things can be affecting our sex life. But the truth is that many women continue to have fulfilling sexual relationships after menopause. And so while some have decreased libido, vaginal dryness, there are a lot of symptoms, including testosterone therapy, vaginal estrogen, which is completely safe even if you're a breast cancer survivor. There's various treatments to help manage these symptoms. And it's not just in your head. Again, how we feel about our bodies affects our libidos, 100%. But there's actual vaginal dryness from low estrogen that affects our libido, and lower estrogen alone and testosterone that declines with age that's affecting our libido. Myth number 4, weight gain during menopause is unavoidable. Now, this is kind of two-pronged. Truth is, although our hormonal changes can influence weight distribution, maintaining a balanced diet and regular exercise can help manage weight during menopause. But when I see these influencers online, typically men who are like, it's BS, menopause doesn't affect your body at all. That's not true either. Okay. It does affect where our body stores fat. Now we're starting to store it in the belly. We're not handling stress as well, which also affects our cortisol, which contributes to belly fat. And our resting metabolic rate is affected. So declining estrogen, it affects our appetite control. I've talked in a previous episode about how our needs for protein go up. And so we start trying to compensate the need for protein, but sometimes we do that in the case of extra calories. Now that is a controllable factor, but our declining estrogen alone reduces our resting metabolic rate 200 to 300 calories sometimes. So up to 200 to 300 calories less that you are burning from your lower estrogen. So we can feel like we're running just to stay in place. But this does not mean that weight gain is unavoidable. You absolutely can change your body and use exercise and use diet and use the tools that we're talking about to still feel good in your body and have a good body composition. Myth number 5, menopause happens at the same age in the same way for all women. We know this isn't true. We know that the onset of menopause varies among women. It typically occurs between 45 and 55. So if you're below 45, you're technically early, but still relatively common. After 55, it's a little bit late, but that is the general time frame, and it can happen 45 to 55, and it can happen earlier or later. So let's touch briefly on evidence for herbal remedies, because many women explore herbal remedies to alleviate their menopausal symptoms, especially if they're seeking alternatives to hormone therapy. And hormone therapy, like I said, that's a whole nother topic we can do. There's so many misconceptions. It causes cancer. Guess what? Alcohol consumption causes cancer more than hormone therapy ever could. But the thing is, it's essential to consider the scientific evidence. I'm all for if a woman wants to try herbs first, but we don't have a lot of evidence. And this is why what I've seen clinically is women get really mixed results. Some women get really good results from the herbs and others don't. And so managing perimenopausal and menopausal symptoms through herbs alone, the results are mixed, both in research and what I've seen clinically. So black cohosh, commonly used for hot flashes and night sweats. Some studies suggested help, results are mixed. I've seen mixed results in my practice, but it's one of the most commonly used botanicals. And it does have some other benefits, some anti-inflammatory and antioxidant potentially. So again, if there's no contraindications, it won't necessarily harm you, but it may not be the miracle cure that you're looking for. Sage has shown some promise in reducing hot flashes, sleep disturbances, and night sweats in some trials. The dosages for sage ranged from 100 to 450 per day. And some evidence also suggests it may help with body aches and joint pain and mood. So sage is something that you could consider if you wanted to try an herb. Again, looking at what are your medications, ideally working with a practitioner, making sure there's no contraindications. Mixed results on soy and red clover, but some small trials showing that they can reduce hot flashes. Again, findings are inconsistent. And things like St. John's wort, they can help mood swings, mild depression associated with menopause. I didn't mention that, but women are more likely to have anxiety or depression triggered in menopause and perimenopause, like significantly. I can't remember what the percentage, but like 2.5 times more likely. And if you have a history of depression or anxiety, it's also more likely that that will come up. And so St. John's wort can help with mood swings and mild depression, but it interacts with a variety of medications. So again, consulting a healthcare provider. Evening primrose oil is often used for menopausal symptoms. Scientific support is limited. Again, will it do you harm? It's not one that I use commonly in my practice. So just recapping that. And rhubarb, there have been some studies on rhubarb being used, but those studies were funded by a company that patented a rhubarb product, Estravera. So again, I always look at where the sourcing of the research is from. but I have seen some women get results from that. So just because it's funded by the company doesn't mean it can't work, but it makes me decrease the weight of the results of the research. So again, some women report relief from menopausal symptoms through these herbal remedies, and the more research we have, great. The evidence right now, both clinically and in research, is the efficacy is mixed, and they may not be as effective as conventional treatments. So it's important in menopause to utilize a comprehensive management strategy. Hormone therapy could be part of that broader plan, but it still has to include your dietary considerations and regular exercise and stopping smoking if you're a smoker and minimizing alcohol consumption, which increases your rate of eight different types of cancer, third leading cause of preventable cancer, and even light to moderate drinking increases your breast cancer risk. So this fear we have about hormone therapy, those two classes of wine contribute more towards your risk of breast cancer than hormone therapy. So again, working with someone that understands hormone therapy and having informed decision making is really important. These are natural life transitions. This is something we can embrace. Instead of looking at it at this terrible time of life, let the wise woman in us gather our sisters, so to speak, together and really find our power, find our true wisdom, and find balance in our lives. This can be an amazing time of life. I feel better now in my 50s than I did in my 40s. And I felt better in my 40s than 30s. It can get better. And so when you're looking at what to do, I am really big on informed decision making, informed consent, shared decision making with the people I work with. So please work with someone that wants to talk to you about the actual risks and the benefits, and you're a member of that team. Hormone therapy can absolutely be beneficial for many women. It's not a universal solution. I have some women that are like, oh my gosh, it's going to be my end all be all, and they don't feel better on it or they feel worse. And other women, it is a positive game changer for them. There is a window of opportunity when it's ideal, and that is before age 60 and within 10 years of menopause. So if you're over age 60 and you're more than 10 years since you went through menopause, whether it's natural or surgical, your risks increase, right? Well, where early implementation of hormone therapy can actually potentially lower your cardiovascular risk, over 60, over 10 years from menopause can potentially increase your risk for cardiovascular incidents. That doesn't mean it's an absolute contraindication. This is where working with the right practitioners and looking at you as an individual. What are your symptoms? How is it affecting your quality of life? What's your overall health status? What is your family history of heart disease, etc.? And by the way, family history of breast cancer is not a contraindication to hormone therapy. So again, working with a provider that understands all the nuances. And then your personal preferences, that matters. I have women there adamant about not going on hormone therapy, and I want to educate them and dispel some of the myths and some of the fears around hormone therapy. And then once they're educated, I also want to honor what their personal preferences are. Same with other women. They might not want to mess around with herbs. And they're like, I just want hormones. And so your personal preferences matter, your health status, your symptoms, your overall picture. So consult with the right healthcare provider. This is essential for personalized guidance. And when we work with patients in my programs, we take them through everything I've talked to you about, looking at the diet, dialing in the diet, again, the gut. I take people through a whole process. And then when we've address all of these pillars of health, we see what are the hormones still doing? How are you feeling? And where can you maybe benefit or not benefit from hormone therapy or additional measures? So that is what I wanted to cover today. And like I said, we can go deeper into hormone therapy and the risks and the benefits and whatnot in the future. But I wanted to give an overview, give you some information, and dispel some of the myths. So I hope you found this super useful. And I hope that you also remember that this can be an amazing time of life, and your experience is affected by your attitude. Your experience is affected by all of these pieces, your lifestyle, your your choices that you make, and we don't have to give up our control. And the doctors and people out there that tell you that this is going to be the worst time of your life, let's reject that. Let's embrace it, but let's get the tools and the support that we need. So thank you so much for joining me for another episode of Up Level Real Health Real Talk with Dr. Jenna Blasi. I love being here with you, and if you appreciate this show, this episode, found it useful, please share it with your friends, leave us a rating, leave a review, and I look forward to next time. Take care, everyone. Thank you for joining me on this episode of Up Level Real Health Real Talk. I hope today's conversation inspired you to take the next step in your health journey, one that nourishes not just your body, but your mind and spirit as well. Don't forget to subscribe so you never miss an episode. And if you found value in today's episode, please leave a review. Until next time, keep learning, keep growing, and keep thriving. And remember, true wellness is a journey, and you are on the right path.